coming up in the next half hour.
No, baby should have to go through something like that.
A baby with brain cancer surrounded by love.
I see you. Thank you for my morning smile.
The proton beam therapy helping baby Kamaya heal.
Just a year or two ago, we would have had to travel someplace and spend 6 weeks out of town.
Want me to give you an arm here?
And the care team treating patients like family.
All right, how are you doing? Okay.
Being able to bring joy in a tough situation is what drives me to come every day.
Having that warmth, having that compassion really helps with healing as well.
Her little life is counting on them to do everything that she needs, and people show up and care and love for her beyond any expectation I could ever have. They'll be people that we remember forever.
We are coming to you from the Dulcie Simons Jr. Family Broadcast Studio here at the University of Kansas Health System. I'm Jessica Lovell. Little Kamaya Miller seemed healthy until right after her 6-month checkup. That's when she stopped laughing, stopped babbling, and stopped making eye contact with her mom. Then her head started swelling, her eyes started to cross, and doctors soon discovered a golf ball-sized tumor growing inside her brain. Since then, Kamaya has spent most of her life at a hospital.
5 rounds of chemo total. We've had the brain tumor removed, so she's had several surgeries, 3 bone marrow transplants, and then we're on our last leg of radiation now.
Alexis Del Cid shows us how a pencil-thin beam of hope is healing her. Before sunrise, Carney Mead pulls into the empty parking lot outside the University of Kansas Cancer Center. Her 13-month-old baby girl, Kamaya, sound asleep. From the quiet darkness into the bright lights of a health system.
Did you have a good night?
Yeah. That never sleeps.
Yeah.
Kamaya's eyes are now wide open. Her doting care team preps her tiny body for the first of dozens of rounds of proton beam radiation therapy.
Hey, sweet girl.
The mission? Eliminate any remaining cancer cells in Kamaya's brain.
I see you. Thank you for my morning smile.
And if they weren't in scrubs, you might think this was a team of nannies.
You gonna let out the giggles? Yeah?
I would have loved to never experience it, but seeing so many people love and care for my daughter, it makes you feel good as a parent.
This small custom-decorated mask, once she's sedated, will cover Kamaya's face and be secured to the table to keep her tiny body still to receive the proton therapy.
You just take it step by step and really lean on the people that are showing up for you.
Back home, Carney's emotions are raw.
No, baby should have to go through something like that.
One seriously sick infant is a lot to care for, but Carney has 3 more little ones who need her.
What's a puppy say?
Woof, woof.
Kaya, who's not even 2 years old, and Capri and Christina, Kamaya's identical triplet sisters.
You can get so wrapped up in the pity, and boy, we had a lot. I had a lot.
How somebody can be as strong as her, and I mean, she's gone through more than anybody I've ever seen, any person in my life that had to go through.
A young mother holding it together with remarkable grace.
I hope she's just proud of herself and me and knows that her sisters were with her the whole way through it, and so were I and my parents. Just how loved she is.
Once Kamaya is sedated, the proton therapy lasts only 15 minutes. Afterwards, members of Kamaya's care team carefully remove the mask, lift her off the table, and wheel her back to the hospital room where she'll eventually wake up. Her little hand wrapped around her mom's finger.
Can you open your eyes?
Kamaya.
They'll be back home in time for lunch, and then they'll do it all over again every morning for the next 5.5 weeks.
If you ask Carney who the strong one is, she'll say it's her daughter.
I think I'm as much meant to be her mom as she is to be my baby, and
All right, bye-bye, sweetie. See you tomorrow. Bye-bye. Thank you.
we're gonna get through this, and this is gonna be a thing of the past when she's all done with it. She's like a little superhero to us, I think.
And Carney joins us now. Carney, how are you doing? Or maybe better question is, how tired are you? Are you getting any rest?
Yeah, honestly, I think my sleep schedule was kind of thrown out the window when I had triplets, but I'm doing good. Kamaya's doing good, so yeah.
So Kamaya has been through about a week of proton radiation so far, 4.5 weeks to go. What are you looking forward to the most once all of this radiation is done and behind you?
Yeah, I think that, just kind of getting Kamaya back right now. She still, has the side effects of being tired from sedation or radiation or the nausea or whatever might come of the treatments. But just kind of getting her back and feeling good and watching her accomplish everything that she's going to from here on out, whatever that might look like for Kamaya, is just really exciting. And I can't wait to see it and be a part of it with her.
So we know that cancer treatment can put off an adult's appetite. How has it impacted Kamaya's appetite? How do you feed her?
Yeah, so Kamaya, one of her side effects of chemo has actually been mucositis, and so she can't keep a whole lot of her formula down. We did have an NG tube placed for a long time, but just kind of as we kind of were ending treatment and she still wasn't tolerating that well, it's called TPN, and it's through her port that she has on her chest. And so hopefully we're kind of working towards, some baby food and back to some formula here in the next couple of weeks. I know she's working really hard with speech to get there, but in order to meet her nutrient requirements, we are doing TPN at the moment.
You are on top of it, doing so well. Kamaya has, as we know, spent a lot of time away from her two sisters. What's it like, though, when they're all back together?
I've always told all the hospital staff just that she just thrives at home. They get so excited to see her, and I think they're better than any medicine that we could give her at the hospital. So when we do get to go home, you're just so excited for her and for them. They're mobile and they're trying to get to her, and she just loves sitting there and watching them play and listen to them talk and hear them laugh, and she'll get in on the mix, and it's really a warm feeling as a mom, seeing all of my girls together and just enjoying that time together again.
So with triplets, what have doctors told you about the risk of cancer in Kamaya's other two sisters?
Yeah, so the triplets are identical, so meaning that they have the same DNA. At the beginning of her diagnosis, I did have to sit down with her doctors and kind of go over the risks for my other daughter, who's not her triplet, and then the other two that are her triplet sisters. And I had to immediately go get them scanned for their brains, and then we did genetic testing for Kamaya, and hers came back that her brain cancer was not due to genetics. So for the other girls, that's a sigh of relief, but definitely scary conversations to be a part of, and realizing how this could have affected, more of my children than just Kamaya.
Sure. Scary, no doubt. But some of Kamaya's care team is here with us today. Dr. Ronald Chen is the chair of radiation oncology at the University of Kansas Cancer Center. Dr. Chen, you grew up in Topeka, you went to Harvard, and now you're back home again. So we're very, very lucky to have him. Also, you're editor-in-chief of a scientific journal, and you have also written several books and national guidelines that teach doctors around the world how to treat cancer. So we're glad to have you here with us during this conversation. Dr. Ronnie Rotondo is right here next to me. He is the Cancer Center's medical director of proton therapy. He's also the first doctor in the world to be fellowship trained in pediatric proton therapy. Good to have you. Okay, Sarah Grigory is our nurse navigator. How are you today?
I'm good, thank you.
So Sarah does a lot of personal hand-holding, if you will. She answers all the medical questions for patients and their families, and we're also going to show you how she goes way above and beyond for patients like Kamaya here in just a few moments. But first, I want to start with Dr. Chen. Dr. Chen, what are the key differences between proton therapy and maybe other more conventional forms of radiation?
Proton therapy is a form of radiation, but the physics of it is a little bit different than other types of radiation. I think what's really important about proton therapy is that the beam that comes out of the machine is able to stop at a particular depth. And so when we're using it to treat a cancer patient, the beam can actually stop at the tumor and not go beyond it. And you'll see in this graph here, this orange part sort of represents proton therapy. You can enter into a patient and then at a precise depth be able to basically stop, so then there's no more unnecessary radiation beyond the tumor. And contrast that with regular radiation, that in this gray part here, that actually continues to deliver dose beyond the tumor and may impact organs unnecessarily and cause side effects.
So Dr. Chen, does a baby as young as Kamaya have other options for radiation, or is simply proton therapy best?
Well, it was really incredible to hear this heartwarming story. But for this particular case, proton therapy absolutely is the best. For a small child with a brain tumor, when radiation is necessary to completely eradicate the tumor and cure the patient, proton therapy in this case is absolutely important because it's able to, in this case, minimize the radiation dose to other parts of the brain, which is so important for a small child who is growing. If we treat other parts of the brain unnecessarily with radiation, the patient might grow up with growth defects or long-term side effects to the brain, or if it's in other parts of the body, may impact growth and delays as well. And so proton therapy in this case is absolutely the best treatment for this patient.
Really sparing those other areas that you're not trying to hit with that. So our Proton Center, as we know, is virtually around the corner. It's convenient, but it's also close to Kamaya's medical teams. How important is that for this little girl?
It's really important to emphasize that most cancers these days are treated with multiple different treatments together. And so this term multidisciplinary care is really important. So many patients might need surgery and chemo and radiation, and the team works together to come up with the best plan to treat each patient to have the best outcome. And so it's absolutely important that radiation is close to the surgeon, is close to the medical oncologist, so we can all work closely together for the patient.
So Dr. Rotondo, Kamaya's cancer is rare. Her treatment, as we know, has been aggressive. What role does proton therapy play?
Right, so her tumor is quite rare. It's a rare aggressive brain tumor that typically arises in kids median age around 2 years old, and so she's on the lower age spectrum. And about 50 to 60% of them occur in the back of the brain where she had the tumor. And so she's had aggressive treatment with surgery, chemotherapy, transplant, but there are always some lingering tumor cells which may remain and increase the chance of the tumor coming back. So radiation plays an important role in trying to eradicate those remaining tumor cells and prevent the tumor, have the best chance of this tumor not coming back. Proton therapy plays a critical role in this case because, again, she's incredibly young and particularly sensitive to the effects of radiation. And so with proton therapy, we can really maximize the chance of controlling the tumor, minimize the chances of acute and late toxicity, and try to achieve the best quality of life for her long term.
Sure. So during proton therapy, as we saw in the story, it's very important to keep the patient still. How do you keep an infant still, even a sleeping infant, from moving around on the table?
Right. So in cases with patients this young, we use daily anesthesia or put the kids to sleep every day. But we also use customized mobilization devices. So in this case, a thermoplastic head mask and a customized head and neck rest. So these ensure that the setup and reproducibility is very accurate so that we can deliver the treatment with sub-millimeter precision.
And we want to bring Sarah in because she kind of does it all. And you have an artistic side along with you as well. You designed and hand-painted Kamaya's mask. Tell us a little bit about this particular design.
Yeah, when I talked to Carney about something special we can do to Kamaya, she told me that all of her girls have a special shade of purple And we wanted to put their initials on that mask to make sure on those days that her sisters can't be there with her, to cheer her up and hold her hand that they really are still there. Their initials are there, their colors, and just a reminder of how loved Kamaya is.
And you do these masks for every pediatric patient that gets proton therapy, and I have to say, she does this completely in her spare time. Why is it so important for you to do this?
I think, in my 20 years of oncology nursing, I realized I can't change the diagnosis, I can't change the hard days always, but I can personalize care for these kids. I can find something bright in this journey for them to look forward to, and sometimes it motivates those kids too to get on the table and do their treatments, and motivates them to come daily and go through this treatment.
Well, when this is all behind them, these masks often represent how far they've come. Yeah. So they're very beautiful, and thank you for doing that for those patients. Carney, you have seen a lot of doctors and nurses and other care team members connect with Kamaya. What really stands out when you see them interact?
So many people go above and beyond to provide care for my daughter, and just knowing that she'll, be with them for a long time. I know a lot of people have been inspired by Kamaya, but just seeing like all the love and just care that they have makes you feel really good, knowing that she's in good hands, and people like Sarah, that it was important to me that my other girls were with her every single day. And so just something as simple as painting a mask really, really does make a difference in such a hard time as a parent or a patient, and things like that.
Well, Kamaya is part of a clinical trial, meaning that doctors will be keeping tabs on her for years. And here's what Kamaya's grandmother said about that.
She's going to be part of decisions of families that are facing this same type of cancer that we'll never know about. She'll be referenced to. She'll be part of information that they need to make decisions. And it's just, that's really truly where I see this at, is like she was made for that purpose. And it's very humbling.
Dr. Chen is a doctor and a scientist. How important is access to these clinical trials?
I think access to clinical trials is very important for every cancer patient. And there's a couple of major reasons for that. In cancer, in any type of cancer, we're not doing as well as we'd like, and there's always room for improvement. We want to get the cure rate as high as possible, as close to 100% as possible, and we want to keep improving treatment to minimize the side effects for patients. And clinical trials is really the only way for us to continue to make that progress. And so for the sake of a cancer patient, participating in clinical trial can actually help them by having access to the latest treatment available that might improve their own outcomes. And for the example of proton therapy is not going to stay still. It's going to continue to get better, more accurate, more precise, and being in clinical trials is a way to help us push that forward.
Well, one thing that Kamaya has in common with all proton therapy patients is the team of renowned scientists and specialists who control that beam of hope. Proton therapy is powerful in the right hands.
All right, let me give you an arm here.
Coming for proton therapy 5 days a week for a month or more means a lot of FaceTime with Aaron, Sarah, Callie, and Dennis. They are the proton therapists handling each treatment.
I mean, it doesn't have to be a horrible, unpleasant experience. Let's try to make it as pleasant as we can.
All four say connecting with patients is the best part of the job.
Me or my family, if they were in this position, I would want them to be treated with compassion, along with the science.
Behind the scenes and before treatment can start,
this is the target, and this is the spinal cord.
Medical dosimetrists like Joseph Vaughn create the best possible radiation plan for each patient's tumor.
As the spinal cord goes through, we're kind of able to push the dose off.
Complex treatment plans can take days to create. Finding the best route for radiation means the most healing with the least harm.
How you arrange your beams can determine how you're able to spare healthy tissues.
The team is backed up by medical physicists like Dr. Yuting Lin. They are board-certified specialists who are experts in the proton machine and the technology itself.
I love my job. I also love physics.
Long story short, they make sure subatomic particles are doing exactly what doctors ordered.
Long story short. Long story short.
It's a tight family in here, so
It's a very tight family in here.
Together, this team collaborates on every single patient's case to deliver a powerful beam of medicine in the most accurate, effective, and compassionate way.
Okay, we'll see you tomorrow, right?
Yes.
All right.
All right.
We'll see you then.
Okay, now that team seems fun to work with. Dr. Chen, we want to let you brag on some of your team that we just saw. And we want to start with dosimetrist Joseph Vaughn, who I hear is a very humble person, but perhaps should not be. Why is that?
Well, first, let me explain what a dosimetrist does, because I think a lot of times the cancer patient comes through and they just see the doctor and they really feel the doctor actually does everything, which is actually not correct. We work with a team. In a radiation oncology department, in a proton therapy program, the dosimetrist is the person behind the scenes who actually creates the radiation plan for each patient. And we look at where the tumor is, where the surrounding tissue relates to the tumor, and the dosimeter actually helps us figure out the right angle and the right beams and the right energy to come up with a plan for each patient. Now, let me just brag on Joseph real quick. For each patient, there's probably an infinite number of angles that the proton beam can come after the tumor, and each angle that you shoot through may impact different organs. Joseph has won 2 world competitions in dosimetry, which means that there's these world challenges where you have a cancer patient and you want to design the best plan possible to not only target the tumor but spare the surrounding organs as much as possible. And we have people enter their best plan from all over the world, cancer centers from all over the world, and Joseph has won 2 world competitions with the best plan. That's the kind of person we have on our team here at KU.
So he's kind of a big deal.
Yes.
Yes. All right. Well, in the video, we also mentioned our medical physicist, Dr. Yu-Ting Lin, board certified. What does that mean for patients?
Well, another part of our team are these medical physicists. Medical physicists, what they do is they're really experts at the radiation, in terms of the radiation machine. And Dr. Lin is a board certified medical physicist, and we recruited her, and she really is an expert at the proton machine. And as I said before, proton is not going to stay still. It's going to continue to get better. And Dr. Lin and her team of medical physicists really is trying to make sure, one, right now for our patients, the machine is as accurate as possible, but also they're doing research to make sure proton can be even more accurate as we go forward.
And let's talk about our team of therapists. We have Dennis, Callie, Sarah, Aaron. Truth be told, Doc, who sees the patient more, you or them?
Well, the therapists actually are the staff members who treat the patient every day on the proton machine. So they see the patient, they greet them, they put them on the machine, and they are actually the ones that make sure the beam is as accurate as possible for treatment every day. And when a patient comes in, 5 days a week for treatment, and maybe it's for 4 to 5 weeks of treatment, they really see the therapist every day, and they probably see them more than the actual physicians.
We had said that going to an NCI comprehensive cancer center can lead to a better diagnosis. But does NCI status make a difference when it comes to proton therapy, Dr. Chen?
Absolutely, I think so. An NCI designation, NCI stands for National Cancer Institute. An NCI designation for a cancer center is a stamp of approval from the National Cancer Institute that says that we have the right expertise in cancer. And I think for proton therapy, it's so important that not only do we have the right equipment, but we have the right team of physicians, dosimetrists, physicists, therapists that's actually able to take care of the patient. And that experience and expertise is so important and absolutely contributes to the best outcome for each patient possible.
Dr. Rotato, Bruce has a question asking if my doctor wants to send me somewhere else for proton therapy, but I want to come to you, what do I tell my doctor?
Right, so patients can certainly indicate their preference to their doctor, but it's important to note that you don't need a referral necessarily to come and see us or get an opinion. So whether it's an initial consultation or a second opinion, patients can contact the cancer center directly, and we have a wonderful proton navigator in Sarah who will walk them through the process and get them to see the teams that they need.
I want to wrap up today's conversation with our takeaways. Let's start with the ultimate mama bear, Carney. Carney, first, just thank you so much for sharing Kamaya's story with all of us. But what do you want this big key message to be today?
I just think that so many people have shown up for me and my girls. I always say that like we've been blessed in a really unfortunate situation. Kamaya's had really good outcomes with chemo and surgeries and things like that. And we've met amazing people along the way, but so many people show up to my house to help take care of the other girls or whatever it might be. And so having all those people and I know that Kamaya's in a great place right now because of all the prayer chain she's been on, all the prayer lists, all the people that have, there's been like bike rides in her name. She's had a hole in a golf tournament supporting kids with cancer, things like that, there'll never be enough thank yous for all of those people helping Kamaya get to be where she's at now.
Sarah, what do you want the one thing people to take away from today's episode?
I think it's important to, turn around and thank Carney and these caregivers and family members that they don't get days off. They're, she's here at 6:30 every morning, and if they weren't so great taking care of these patients as well, then this all wouldn't work. So thank you, Carney.
Dr. Rotondo, what's the takeaway?
So just that, proton therapy is the most precise, advanced form of radiation therapy available, which really allows us to target the tumor precisely while minimizing radiation to surrounding normal healthy tissue. And what that means for patients is really a high chance of controlling tumor with a significant reduction in both acute and long-term effects of treatment, and really trying to ensure the best quality of life possible.
Absolutely. Dr. Chen, wrap us up. What's the big takeaway?
Well, first of all, thank you for allowing us to highlight proton therapy to educate the community about this. But I wanted to emphasize that proton therapy is not all the same. I think many places can have a machine, but not all proton machines are the same. The accuracy of each proton therapy machine is different in terms of accuracy targeting the tumor and minimizing doses surrounding tissue. And also you want to have the best team possible on your side, on the proton team. The best doctor, the best dosimetrist, maybe the world's best dosimetrist, navigator, nurse, physicist, and that team of operating the machine really makes a difference for every patient.
Thank you all for being with us today. The Morning Medical Update also streams live on Facebook and YouTube. Check out facebook.com/KU Hospital and youtube.com/KU Hospital for more interviews with patients and their expert doctors. Thanks again to our guests, and thank you to you for watching.
We have an update on Kamaya that we want to share with you, and it is a great one. She recently made the news because Kamaya hit a milestone of being 1 year cancer-free. Her mom shared these pictures with us and says Kamaya is working hard on numerous therapies to improve her skills like walking, eating, communicating. Kamaya loves music, dancing, and singing. And here's what her mom wrote to us. She continues to show us how smart, determined, and patient she is every day. We're eternally grateful that she has remained healthy and hope we have many more years of remission to celebrate in years to come. Congratulations to Kamaya and her family and all the patients benefiting from medical advancements like proton therapy. Coming up on the next Choices, Hope, and Science.
For cases like mine, this is the only cure.
There's nothing that would have made me double guess or double think anything with it.
A cancer diagnosis can leave you feeling stunned and overwhelmed. But at the University of Kansas Cancer Center, you don't have to navigate your cancer journey alone. From initial diagnosis until your treatment plan is established, our nurse navigators are there every step of the way. For information on our Nurse Navigator program, please call 913-588-3671.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.